Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week we're talking about pregnancy. So I'm going to go over 3 core exercises that are safe to do throughout the entire pregnancy. So you might wonder, why are we working on our core? You know, your belly's going to grow. You're not going to have a six-pack the whole time. So it's very important to work on your core while you're pregnant because, first of all, you're carrying more weight in the front. You're going to start to have low back problems. Also, there's something called diastasis recti. This is the separation of your rectus abdominis, your six-pack muscles. As your belly grows, they tend to separate and you kind of have a small opening here in the middle. And we want to keep them closed as much as possible. So there is a way to prevent that from becoming too wide. Most women do see some level of this happening just, as your belly is expanding, but you can keep it from happening too much. So that's what we're going to work on. We're going to work on strengthening our transverse abdominis, which are the deep muscles here on the side that kind of work as a corset. So they're holding everything together. And we're going to do that by doing a lot of planks and then something called a bird dog. So I have Brooke here with us to help demonstrate the planks. The first one we're going to do is a front plank. And I will mention before you ever start exercising when you're pregnant, do consult with your doctor. Make sure that it's safe for you. And also listen to your body. So if you are tired before the workout, listen to yourself, I'm not ready to do this today. Or if you're doing the workout and you become very exhausted, stop immediately. Don't push yourself too hard. All right, so back to the front plank. We're gonna show you some different levels of difficulty also. So the first thing we're gonna do is she's gonna go down onto her forearms and she's gonna keep her knees down. So this would technically be the easy plank. So she's going to keep those knees down and then the elbows are right below the shoulders and she's going to hold it there. She's going to keep her back nice and flat. We don't want to raise the hips up to arch the back and we don't want to lower the hips down to create a little dip there in the back. It's going to cause some back issues there. So just keep it nice and flat. Another way, obviously, as your belly grows, it may tend to touch the ground as the pregnancy continues. So you can go up onto your hands with your hands right below the shoulders, and then again, straight back, and she still has her knees on the ground. All right, so the next, like I said, this is technically the easy plank. So the next one we're gonna go to is more difficult. We're gonna show you first back down onto the elbows, and then she's going to pick her knees up, and she's gonna be up onto her toes. Again, she's keeping the back nice and flat. She's not dipping, she's not arching. She's keeping it nice and flat there. All right, again, as your belly grows and may touch the ground, you can go up onto your hands, just like that. And again, staying on her toes and the back is still flat. Just remember when you do go up onto your hands on this one, to collapse to your knees when you're finished. So obviously you're not collapsing all the way down. Common sense, I would think. But all right, so that is it for the front plank. Next we have side planks. So this time she's going to be on her side with her feet and her knees stacked on top of each other, and her elbow is right below her shoulder again. She's down onto her forearm again, and she's picking her hips up off the ground, and she's kind of creating a straight line here. She's not sagging her hips down, she's not raising too high. We're just keeping a nice straight line. She's really going to feel it through her sides. Right? A more difficult one for this would be to go all the way up onto her feet, so just like that. So her knees are now off of the ground, and she's holding her weight up there through her forearm and her feet. Again, straight line. If you feel like your balance is a little off, you can put your arm down in front, maybe not resting all the way down, but keeping it there just for safety. And you can also separate the feet, so one foot in front of the other, just if you're a little worried about toppling over like that. So my recommendation for the plank is to hold it for a few breaths. If you're new at planking and it seems hard at first, hold it for a few breaths and then rest. Or you can work yourself all the way up to 30 seconds or whatever is comfortable. Again, if you start to feel exhausted, don't push yourself too hard. All right, so the last one we're going to do here is the bird dog. So she's going to move to her hands and knees. She's going to lift up one arm and then lift up the opposite leg, like so, just like that. She's keeping her head in a neutral position, so she's not looking down towards her knees. You want to stay looking right about towards your hands, or you can look up, whichever. And then she's going to, count to 2, count to 3. She's going to switch. keep alternating. Obviously, the longer she holds it there, the harder it's going to become. So again, if you're a little worried about your balance, just don't hold it as long. Another way to make it a little more difficult is to raise up with her arm. There we go. And now she's going to bring her arm out, back to the front, and then she's going to rest down. She can alternate that way as well. But again, be very careful with your balance. But just like that. All right, so as I mentioned before, just check with your doctor to make sure that it's okay that you're exercising. Listen to your body, don't push yourself too hard. But like I said, also these are safe to do throughout your entire pregnancy. So that has been this week's Fitbit, and we'll see you next time.